Will AI be a part of how we do mental health? The question is actually that ship has sailed. It's how can we really optimize AI to help us as we're trying to solve the problems associated with mental health, things like barriers to accessing care, not being able to have enough therapists and workforce shortages. How can we really optimize the use of AI to help us solve these problems that we've faced for decades?
That's Dr. Smita Das, psychiatrist and professor at Stanford School of Medicine. Her professional experience and clinical expertise help shed light on how mental health challenges are showing up at work in ways employers can't ignore, especially for Millennials and Gen Z, who now comprise most of the workforce. I'm LuAnn Heinen, and this is the Business Group on Health podcast, conversations with experts on the most relevant health and well-being issues facing employers. We explore what younger workers are feeling, what's changed in mental health care, and how employers can respond with clarity, compassion, and action. Mental health in the U.S. workplace remains a challenge. Millennials and Gen Z, who make up more than 2/3 of the workforce, bear the heaviest load. They reached adulthood burdened by debt and rising costs, especially for housing. Nearly 40% of Gen Z and 35% of millennials say they're stressed or anxious most of the time. Rates of depression have climbed with no sign of reversing. This distress often isn't obvious. It can show up as irritability, conflict, or a drink that becomes two. Employers have made real progress in reducing stigma, but conversations around addiction, serious mental illness, and suicide remain urgent. The tools are getting better. Teletherapy works. AI, approached carefully, may be able to help close the gap between need and available support. So the playbook exists, but is it gaining traction?
As we know, we spend the majority of our life during our working years at work. So work is definitely a contributor to these patterns.
Dr. Smita Das is a psychiatrist specializing in addiction and a clinical professor at the Stanford School of Medicine. She serves on the Advisory Council for Workplace Mental Health at the American Psychiatric Association Foundation and was a former VP of Psychiatry and Complex Care at LIRA. She says frustrations build up, feeling unrecognized at work, putting in long hours, lacking purpose, feeling unsupported. And now layoffs and the unsettling rise of AI in the workplace are adding more uncertainty that previous generations just didn't face.
This is a really interesting time. I talk a lot about, as I'm discussing workplace and mental health, the generational hardship these generations we're talking about are facing. A lot of them, for example, are in the sandwich generation. I myself am in the sandwich generation, where I'm one, both caring for children, but also caring for and looking out for the needs of parents and elders. In addition to that, parts of the younger generation, Gen Z, for example, they're dealing with things like student loan debt, housing shortages. And then there's also, of course, kind of more existential threats that we're experiencing in real time, like climate change, or obviously the lingering aftermath of the COVID-19 pandemic.
One major threat to young adults is substance abuse. Dr. Das talks about it as a problem hiding in plain sight, costing employers hundreds of billions of dollars.
I think that substance use is something we need to keep an eye on. Untreated substance use disorders really do contribute to workplace costs. The cost is in the hundreds of billions for employers when it comes to substance use disorders, especially that are untreated. 1 in 10 adults still has an alcohol use disorder. That's not an insignificant number. And then other substance use is also on the rise. So, for example, cannabis use, which is becoming more accessible and also more potent, is leading to higher rates of cannabis use disorder, such that 6 to 8% of the adult population has an addiction to cannabis now. Some people are using substances that can affect their mental health at work, but mental health at work can also lead to people trying to cope with substances. And so that's something that's of concern.
Well, given that rates of alcohol use are falling in younger populations, maybe not so much in the Gen X and Boomer, are you seeing that making a difference in these younger populations?
You know, I am hopeful for that to play out. And you're right, we are seeing this trend of younger populations saying they don't want to drink alcohol. Unfortunately, it's the case that even though kind of on a use basis, where we're looking at the population and use rates, we don't see that translation yet into use disorder rates, so the addiction piece of it. Unfortunately, what we have is something where there's less people that are using alcohol heavily in these younger ages, but there's a subset of those groups that are continuing to use alcohol in a unhealthy way, which is the addiction to alcohol. Just because somebody is using a substance doesn't mean they have an addiction to it. Unfortunately, the people that are suffering from the addiction aspect are kind of suffering in more ways.
Let me just ask if you have seen any change in eating disorders or have any greater concerns about eating disorders in light of the prevalence of GLP-1s and how much they're talked about in the workplace and elsewhere, everywhere.
I think that's a really interesting area that we'll hopefully get some more data on to say definitively if there is an impact to eating disorders. I have not seen yet a change in my clinical practice with eating disorders related to GLP-1s. What I have seen, though, is kind of this trend, interestingly, in males of the concept of looks maxing, which I'm, as a kind of an older millennial, I'm trying to understand myself. But this need to try to achieve a really optimal physical appearance that can sometimes lead to unhealthy use of things that some of my patients have used, supplements or testosterone or other things that they are able to get online, and engage in unhealthy practices to achieve kind of this quote unquote optimal look. But it can be really dangerous and really impact other things like mood, depression, suicide rates, and so on.
Yeah. I read recently that Americans legally bet $167 billion on sports in 2025. What do you think about gambling as an addiction and what impact that's having public health wise?
So gambling addiction is definitely an emerging concern. So we've always managed problematic gambling in psychiatry. That's been a part of the work that I've done, but it's gone to another level now. So there's a few contributors of this. One is definitely the gamification. The gambling is online and it's very gamified. And so it is very reinforcing, meaning that like for a drug, a substance, if something can create a reaction in the brain, then how fast that happens actually leads to how reinforcing it is. And so that somebody wants to come back and use it again. Similarly, with gambling, especially some of this online sports betting, it is gamified. And the people that are developing these sites, they know how to create that same reaction in the brain of somebody who's sports betting as somebody who, say, is using alcohol or heroin or stimulants. And so that gamification of finance and sports betting is really concerning. Also, there's a lot more availability and access. It's not that you have to go to a physical space or make a phone call to place a bet. You can do it at your fingertips now.
But not so much for women, right? Is this pretty much young men?
So far, we've seen this problematic behavior more in men, but these things can change. For example, through the pandemic, we saw rising rates for heavy alcohol use in women. So we never know when these things can change.
I have to ask about death by suicide. What do we need to know about this among the Gen Z and millennial populations?
Yeah, it's definitely a good topic to bring up because oftentimes it's kind of swept under the rug and not talked about. So it's very important for us to talk about it. There are really high rates of depression. I mentioned earlier, 39% of Gen Z reporting some struggle with depression in the last couple of years. Employers and population in general needs to be very concerned about the risk of suicide, which can increase not just with depression. It's certainly one of the biggest risk factors that we consider, but even with substance use and other psychiatric disorders, and also psychosocial things like limited resources, stress, so on. Suicide is actually the 11th leading cause of death in the US. It's the second leading cause of death for people 10 to 34 years old. And we have one suicide every 11 minutes. So oftentimes groups will be hesitant to talk about it. It's very, very relevant to this population. It's very relevant to workplaces. I can say, having worked in the field of workplace mental health for a long time, suicide, it affects so many people. Obviously, the individual who is affected, their family, but the teams, the overall workplace, the culture, it really does shift things and change things. And I hope employers do look at this sooner than later and before they have to kind of manage a tragic event.
This is the Business Group on Health podcast, and we're talking about the critical importance of mental health on the job. Let's start with the playbook published by the American Psychiatric Association Foundation. Its mid-career professionals playbook and resource guide was released in 2025. It draws on the APA's survey data showing that most employers aren't equipped to respond to the mental health crisis we're seeing in populations of Gen Z workers, which today are people in their 20s, and millennials, who are considered to be 30 to 45.
The APA Foundation Center for Workplace Mental Health decided to do this playbook because we know that millennials and Gen Z are actually now the majority of people in the workforce.
That's the director of the APA's Center for Workplace Mental Health, Betsy Schwartz.
They particularly emphasize the importance of mental health care. And so the playbook, which we actually called a playbook rather than a toolkit, because we see it as a very practical, hands-on playbook of what an employer can actually do to make sure that they're responsive to the real needs of millennials and Gen Zs.
Betsy says the playbook includes an overall description and scope of the problem and what's in it for a company to address the issue. And it shows companies what mid to young professionals are looking for.
There's a lot of myths associated with what young professionals are looking for and expect. And we wanted to dispel some of those myths. Perhaps most importantly, are what are some of the best practices? What are best practices that employers are already using? And what are some best practices that they could be using? And last but certainly not least, the playbook includes several really great resources that companies can drill down to have a better understanding of what the issues are and what the solutions could be.
APA research shows Gen Z and millennial workers want to normalize mental health care. When leaders disclose their own struggles or those of their families, it creates a green light for others to do the same.
They also want to know that their managers have been trained and know how to recognize and respond appropriately to someone who might be disclosing a mental health problem. We know that everyone has the best of intentions. Everyone wants to respond to their coworker or to the employee that they supervise in the most helpful way. But it's really not common sense. Oftentimes, people with the best of intentions say things that might negate the conversation.
The playbook highlights, this is one of my favorite parts. I really like the myths, dispelling myths about young professionals. I'm going to throw one at you. Young people are addicted to social media and want everything to be digital or remote. True or false?
That's false. The addiction to social media might be true in some cases, but I think the point is that millennials and Gen Z really want personal connection. Connection and relationships are very important to them. And while they may have relationships that they've established through social media, when it comes to work, they want to be able to go to the office and connect at a personal level. So they want the flexibility to be able to work remotely when needed or part of the time, but they also really appreciate coming into an office and having connection. And also, I know from our own workplace that the culture is such that there are many opportunities for us to connect with each other, whether it's lunchroom events or walks or company events. All of those opportunities to really get to know your coworkers is important to this population.
What do you hope employers will take away from this playbook?
I think what's most important for people to take away from this is that it's in their best interest to really invest in the success of this population, because we know that millennials want to feel connected to the purpose. They want to understand their own personal ownership of the issues. And once they are engaged in that ownership and purpose, it will increase their overall engagement in their work, which will yield greater productivity. It'll also yield a higher retention. And we know the cost of having an employee leave and having to recruit and train someone new to fill that position. So it's very important that employers understand that investing in the needs of this population will increase their bottom line.
The way people get mental health care is changing fast. Virtual mental health care has gone from a pandemic workaround to a preferred option. Asynchronous tools such as exercises, education, and check-ins are extending the reach of therapy into the spaces between appointments. Now AI is entering the picture, and the debate is no longer whether it belongs in mental health care, but how to use it wisely. That includes confronting a hard question. What happens when it goes wrong? I asked Dr. Das whether one-on-one in-person therapy may be going the way of the horse-drawn carriage.
It really does vary from person to person. I, as a traditional psychiatrist and therapist, thought that one-on-one in-person therapy with the kind of the feeling in the room and all of the things that I learned in my training was the way to go. Over time, though, I've been pleasantly surprised about how much individuals are excited about things like doing teletherapy or having virtual care or having tools available asynchronously so that they can try to develop their care in the background. And this isn't just because of convenience. Of course, it's more convenient for both the therapist or the treating provider and the patient. But it's also nice because the outcomes have been really impressive. When somebody's able to get virtual therapy, it really reduces a lot of the barriers. And so we can actually see higher engagement. One of the programs I built in my previous role was our addiction program. And I was delighted to see that individuals who hadn't sought care in the past because they were too afraid to go to an in-person treatment center or go to a place that has kind of the words addiction written across it were able to seek care and complete care within the privacy of their own home or their office at times that worked for them. Data like engagement is really excellent, and being able to reduce the barriers has been wonderful.
Okay, so asynchronous is when I have an issue, a burning issue I want to talk to my therapist about, and I put it in a chat and I might get an answer hours later. Is that right? Or what is asynchronous exactly?
Asynchronous can be what you just described, which is when somebody is chatting and their therapist or their physician responds later. But it also includes fortifying your recovery with information between sessions. There's all this time that goes by between when someone is face to face with a therapist or a physician. And so that time is really important because that's the time we're actually living and needing to use those skills. And so having tools like psychoeducation, like exercises in the old days referred to as homework for our CBT or our cognitive behavioral therapy clients, that technology can be much more engaging, can be something that someone uses in the moment. For example, if I have a stressful morning, maybe drop off was really hard and we were running late, but then I didn't end up using yelling or irritation as a coping skill. In that moment, I can pull out my phone and complete an exercise and say, how did I do that? Or if it didn't go well, then how could I have done it differently? And so this work in between sessions is really important to solidify the coping skills that are so crucial to therapy and recovery.
Okay, so in between your therapy sessions, the therapist puts stuff out there, or how do you find that as a consumer, what it is that you should be doing in between given your situation?
Yeah, increasingly there are services that will give you that asynchronous content where the therapist will assign it. These days, especially when we have more AI involved in therapy and healthcare, then AI can help assign that information, of course, with a therapist checking on that. But then also, I would say that companies and employers are providing more psychoeducational content in either kind of from themselves or through their service provider as a mental health library. So maybe I'm not sure what's going on with my mental health and I get, say, a diagnosis that's less familiar if I'm a patient. Maybe it's a diagnosis of OCD. Well, maybe in this mental health library, there's information about what obsessive compulsive disorder is. So I can learn about it and say, I identify with that. And it's really nice to have these libraries because it's better than, say, using the internet and all the things that are just out there that may or may not be accurate. I would rather have the information come from a trusted source, for example, like the American Psychiatric Association Foundation Center for Workplace Mental Health.
Okay, and those resources online exist whether or not you're seeing a therapist.
Yes, they can be part of the therapy episode and from the therapist, but then also I would recommend using, again, trusted, more evidence-backed resources that are online or offered through employer benefits for more information.
Okay, so we mentioned AI, but not in the sense of, okay, I want someone to talk to right now, and I'm typing into ChatGPT or one of the other AIs. What's your point of view on that?
I will say my point of view has been evolving as I've seen the power of AI. Again, as a researcher and as a self-proclaimed old school psychiatrist, I generally tend to be skeptical of new technologies. However, I don't think anyone can deny the impressive rate at which AI has been able to really transform so many different ways of working. In the past, when I've had these discussions, for example, with professional societies or in academic settings of will AI be a part of how we do mental health? The question is actually that ship has sailed. It's how can we really optimize AI to help us as we're trying to solve the problems associated with mental health, things like barriers to accessing care, not being able to have enough therapists and workforce shortages. How can we really optimize the use of AI to help us solve these problems that we've faced for decades?
And control the rogue AI, where there have been a few but very terrible and publicly reported cases of AIs encouraging self-harm.
For sure. This is extremely important in medicine as a doctor. First, do no harm. It's extremely important that any solution has safety as its foundation. Without that, we really can't move forward. So I completely agree that we need to, in any clinical practice, anything that has to do with people's lives or how we interact with patients, safety comes first.
In the first part of my interview with Dr. Das, we talked about what the problem is. But in this last part, we look at what employers can do. They can normalize employees seeking mental health benefits and resources and make these more accessible through education campaigns and trainings. And it goes beyond benefits. For younger workers just starting out, trust, purpose, and authenticity are the essential building blocks of workplace culture.
A word that always comes to mind when I'm thinking about the topic of authenticity and trust is transparency. So this is transparency on multiple levels. For example, if there is a really difficult event that happens at work, let's say that there is a really large set of layoffs. Again, we've been seeing a lot of this happen recently. Understandably, it's hard to have transparency before the event because of how these things go. But once the event has happened, both for the affected and non-affected employees, being very transparent about why this is going on, what's going on, not necessarily sugarcoating. I think some of the leaders and CEOs that I've worked with in the past that have really built trust were just very real and open and genuine with everyone about where things are at. Still optimistic and hopeful, but being real and again, transparent. I think transparency also extends to what is the company's corporate social responsibility? Where do they stand on things? This has been interesting to see because I think employees are actually increasingly interested in this topic of where their employers stand on various issues. And finally, of course, being transparent about the company's mission and goals, being open about what is their mission? What is their actual mission? What are the actual goals and objectives? How does everyone's role play into that? And how can each individual employee affect that mission and goals?
A narrative. What's the company narrative and how to communicate that? Then there's policies that are a really tangible manifestation of the company's beliefs and culture.
Yes, for sure. These generations, the millennials and Gen Z, they really value policies that are rooted in flexibility. We had the COVID-19 health emergency, which did introduce this idea of remote and hybrid options, non-traditional schedules. Some places are even playing with the idea of compressed work weeks, little things that are actually small investments that end up having huge payoffs, like having mental health days are really appreciated by employees. Generally, they would like to be not trusted so that they're not necessarily micromanaged in terms of time of you're here on these days doing these things at these hours. Of course, some roles do require that because we need to have 24/7 coverage of some work, but rather kind of for the roles that don't require that, following productivity and just are you getting your work done? Like, as long as you're getting your work done, that's fine. That you have to take your child to a soccer game or you have to take your mom to their doctor's appointment. This is all very important to these generations. And then when things are more severe, when they have a need for mental health leave, being able to take that leave and to do so without judgment is also important.
Another point from the survey that's described in the playbook is that employees have, quote, difficulty accessing professional help, meaning that they don't know where to find someone or how to find the time to access help. How might employers address that?
Yeah, it's not enough for an employer to kind of check the box and say, I have a mental health benefit, but really, really what we should be looking at in terms of metrics are how well engaged are the employees with that mental health benefit. Streamlining access is crucial here. This can come in multiple ways: on-site counseling, having a central place where all of the benefits are. An individual shouldn't have to go through 15 representatives and 10 websites to get help. They should be able to get help very quickly. And so as employers are kind of looking at how their benefits and their services are being laid out, as well as who their vendors are, just keeping in mind, what can we do to reduce friction so that our employees, while they're already struggling from a mental health perspective, don't have to be even more mentally taxed by having to figure out how to get that help.
I wanted to ask you about manager training, and particularly, what is it that realistically can be trained?
Interestingly, I think, one would think, that they can't actually be trained. But when we break down things like warning signs of mental health concerns, for example, like how the Notice Talk Act at work does, it actually makes it super accessible so that a manager can be trained to observe those signs, so that a manager who had an employee that they might say, that employee is just, they're a little quirky, or things are a little off, or they're going through something because their child just started preschool or something, rather than just kind of shrugging things off as that these trainings can help identify more concrete signs someone might be struggling, and more importantly, can help give concrete, actionable steps to do something, whether that be checking in with the employee, providing resources, and so on. And so these are not things, it's funny, even as a physician, these are, as a physician who's a physician leader, I was never taught in medical school how to manage people. On top of that, how to manage other people's mental health. This is really important education that is actionable, that is concrete, that managers can actually work with and take away useful skills from.
We leave you with these words of advice from Betsy.
So it's very important for companies to really make sure that people constantly are reminded of how to access the benefits and what they are.
Right. Any insights as to what are the best ways of doing that?
Repeat, repeat, repeat. It's not an email sent out on a special day. It has to be a consistent drum roll of making it normal to want to know what these benefits are.
I've been speaking with Dr. Smita Das and Betsy Schwartz about how stress, anxiety, addiction, and burnout are often hidden, yet their impact is real for people and for organizations. For employers looking to enhance their role in supporting employee mental health, check out the American Psychiatric Association Foundation's Mid-Career Professionals Playbook at workplacementalhealth.org. I'm LuAnn Heinen, and this podcast is produced by Business Group on Health with Connected Social Media. If you liked the episode, please rate us and leave a review.